Masks are back. COVID-19 and its serious Delta variant are surging, and the Centers for Disease Control has just issued new mask guidance. It says most vaccinated people should wear masks indoors in public places. About 30% of the U.S. population remains unvaccinated, with some just resistant to getting the shot. COVID is striking mostly the unvaccinated. Now some employers are starting to mandate vaccines. Several Wisconsin medical groups say their team members must be vaccinated. The Medical College of Wisconsin is one of them, and we're talking now with President and CEO Dr. John Raymond. Dr. Raymond, thank you for being on the show today. You know, I saw an estimate that 1 in 4 hospital workers aren't vaccinated, which tells me that even some people in the medical community are hesitant about this. What if someone at MCW says they won't get the vaccine? Does that person still have a job?
It's a good question. We're going to continue to try to encourage people to have their questions answered if they're hesitant. And we do have medical and religious exemption opportunities for people that have strongly held religious views or a medical reason not to be vaccinated. We do have a policy, though, that would allow us to separate from employment if people continue to not want to be vaccinated and don't have one of the exemptions. We hope we won't reach that point, but when we implemented mandatory influenza vaccination about 7 years ago, we actually did have 2 individuals who ended up separating from MCW employment.
And that's a good example to see what could happen now with the COVID vaccine. The CDC says most people should wear masks inside now, even if you're fully vaccinated. I think this has people confused, though, in terms of why this new decision and what evidence is supporting it.
Yeah, well, the CDC recommendation always did advise caution if you were interacting with unvaccinated people in large numbers in indoor spaces. So that hasn't really changed completely. I think there's more of an emphasis. What we now know is that the Delta variant, which is the predominant variant in the US, which it wasn't just a few months ago, is much more contagious than any previous variant that's been circulating here. It impacts younger people, especially unvaccinated people, and it seems to cause more severe disease. We've also known that it was more contagious, but I think something that really should give us cause for concern is that we know now that the Delta variant is as infectious as chickenpox, which spreads very, very easily. So I think the idea is, even if you're vaccinated, you should have an extra layer of protection for yourself, and especially those around you. Because if you're vaccinated and you do get COVID-19 with this Delta variant, you probably have mild symptoms like the cold, sneezing, runny nose, headache, and you may not even know that you're sick with COVID, and you can pass it on to vulnerable people around you.
Well, and the CDC is now saying also new information that individuals infected with the Delta variant may be able to transmit the virus just as easily, people who have the vaccine versus people who don't have the vaccine. So how concerned are you about breakthrough cases in Wisconsin with that new information?
Well, first of all, we don't need to panic, but let's use this data to make smart interventions. So what we know now that we didn't know 2 months ago is that people who have been vaccinated still can have high loads of virus in their nose and mouth, maybe as much as 1,000-fold higher than some of the previous variants of COVID-19. And even if you're not feeling sick, if you've been vaccinated and you have COVID-19 Delta variant, you can very easily pass it on to someone else. And this is new information that we didn't know a few months ago.
Some experts are predicting a pretty grim fall. What are you expecting?
I think it's difficult to know. We could have a grim fall. It could be as bad as it was in Missouri and Arkansas a few weeks ago, and as bad as it is in Louisiana now. But let's hope that it's more along the lines of Israel, which did reach 60% vaccination and now is having a surge of Delta. What we've seen in Israel is that only people who are unvaccinated or who are vaccinated and are in highly vulnerable groups, like the aged or people with pre-existing conditions, seem to be getting severe disease. So they have reimposed mask restrictions, social distancing restrictions, and are even now recommending a 3rd booster dose of the mRNA vaccines for people in vulnerable populations. And again, the ones they're considering are people over the age of 60 and folks with pre-existing conditions like obesity.
And now, considering we know about these breakthrough cases, that you could spread the Delta variant if you're vaccinated, that the CDC is asking you to wear a mask even if you're vaccinated. I mean, people got so used to not wearing masks. Can we really put the genie back in the bottle on this and rally the troops to wear masks again, you think?
Right. Well, it is very difficult to put the genie back in the bottle. Let's face it, all of us are tired and exhausted from all these mitigation measures. But if we want to avoid a grim fall or a grim winter, the best thing that any of us can do individually or as a community is be smart. Wear a mask, limit interactions with people who've not been vaccinated, avoid crowds, and and if you're not vaccinated, please do get vaccinated.
Dr. Raymond, we appreciate your expertise. Thank you.
Thanks, Adrienne.
Coming up, a family using a rare legal process to try to charge an officer for a fatal shooting. Could it set a precedent in Wisconsin?